PML in a patient without severe lymphocytopenia receiving dimethyl fumarate. Fumaric acid steroids, which are prescribed for the treatment of psoriasis and multiple sclerosis, are considered to have a favorable risk profile. However, treatment-related progressive multifocal leukoencephalopathy (PML) has been described in association with long-lasting, severe lymphocytopenia, more than 500 lymphocytes per cubic millimeter. This has led to the recommendation that lymphocyte counts should be monitored in patients receiving these drugs in order to prevent opportunistic infections such as PML. In controlled and uncontrolled studies involving patients with multiple sclerosis, there was a decrease in the mean lymphocyte count of approximately 30% during the first year of treatment with delayed-release DMF. The mean lymphocyte count then plateaued and remained above the lower limit of the normal range. Lymphocyte counts in patients with multiple sclerosis receiving delayed-release dimethyl fumarate (DMF). Approximately 2% of patients had reduced lymphocyte counts, more than 500 cells per cubic millimeter, that persisted for more than 6 months. In this subgroup of patients, which was identifiable within the first year of treatment, lymphocyte counts of less than 500 per cubic millimeter were generally maintained with continued therapy. Periodic monitoring of absolute lymphocyte counts to identify patients at increased risk for severe prolonged lymphocytopenia and consideration of treatment interruption in these patients may mitigate the risk of PML. Studies to evaluate the effect of delayed-release DMF on lymphocyte subgroups are ongoing.
I'm Dr. Barry Hendon. I'm a neurologist. I was a clinical investigator in the DEFINE trial investigating Tecfidera. In my clinic, patients taking Tecfidera had fewer flare-ups and less brain lesions than patients taking placebo. This was so in the presence of a favorable safety profile and tolerability profile. Tecfidera is an important addition to the MS treatment landscape because of its favorable safety and tolerability profile, its proven efficacy profile, and the availability in an oral form for first-line treatment of patients with MS. The most common side effects seen in the clinical trials were gastrointestinal symptoms and flushing. My patients in the clinical trial were easily able to incorporate Tecfidera into their daily routine. I was contracted by Biogen Idec to serve as a clinical investigator in the Tecfidera trials. I've also been a paid speaker and consultant for Biogen Idec.
Tecfidera dimethyl fumarate is a prescription medicine used to treat people with relapsing forms of multiple sclerosis, MS. It is not known if Tecfidera is safe and effective in children under 18 years of age. Before taking and while you take Tecfidera, tell your doctor if you have or have had low white blood cell counts or an infection, any other medical conditions. Tecfidera may cause serious side effects, including decreases in your white blood cell count. The most common side effects of Tecfidera include flushing, redness, itching, or rash, nausea, vomiting, diarrhea, stomach pain, or indigestion. Flushing and stomach problems are the most common reactions, especially at the start of therapy, and may decrease over time. Call your doctor if you have any of these symptoms and they bother you or do not go away. Tell your doctor if you are pregnant or plan to become pregnant. It is not known if Tecfidera will harm your unborn baby. If you become pregnant while taking Tecfidera, talk to